My name is Alex Enriquez. I talk about the Velaparib with first-line chemotherapy and as a maintenance therapy in ovarian cancer. Definition: ovarian cancer that forms in tissues of the ovary. Eh, Most ovarian cancer are either ovarian epithelial cancer or malignant germ cell tumors. Fallopian tube cancer and primary peritoneal cancer are similar to ovarian epithelial cancer and are staged and treated the same way.
The ovaries are the female reproductive glands. They consist of three types of cells: epithelial, germ, and stromal. When the cells in the ovaries grow abnormally, they develop into tumors that can be non-cancerous or cancerous. If cancerous tumors are not detected early, the cancer cells can spread from the ovaries throughout the pelvic region and continue to spread to the abdominal area and other organs. Determining the stage of ovarian cancer is very important in developing a treatment plan. At stage 1, cancer is limited to one or both of the ovaries. In stage 2, ovarian cancer extends to the pelvis area. In stage 3, ovarian cancer has spread to the abdominal region. In stage 4, ovarian cancer extends into the liver, or to locations beyond the abdominal area. Ovarian cancer treatment typically includes surgery, chemotherapy, radiation therapy, or a combination of therapies.
Applications in the medicine. A woman at less 18 years of age who had received the initial histologic diagnosis of high-grade serous epithelial ovarian, fallopian tube, or primary peritoneal carcinoma of International Federation of Gynecology, and obstetric stage ear or 4 were included in the trial.
So in regards to signs and symptoms of ovarian cancer, the challenge is that they're not very specific, so unfortunately, sometimes it takes a while before the patient gets the appropriate imaging to evaluate the ovarian cancer. Typically, patients will have this acute onset of bloating. They realize, oh, this doesn't feel normal, and then it's persistent and it typically doesn't go away. They may have troubles with urinating, having bowel movements, even though their pants are getting tighter because of the abdominal distension and the bloating. Their weight continues to drop because they're unable to eat very much. They get nauseous after eating small meals. But typically what happens is a patient presents to their primary care doctor because the symptoms are so not specific, and that's why they end up getting the GI workup, and then they still have the symptoms, and then they warrant further imaging. We see patients all the time that come in and say, I kept going back to my doctor, and they told me nothing was wrong. It's always important that you're comfortable with your treatment plan, and it's always good to get a second opinion. Unfortunately, in ovarian cancer, there's no good screening test to improve outcomes or improve survival. So patients that have a family history, the most important thing that they can do is make sure that they have genetic testing, and then their follow-up is based on the results of their genetic testing. If we do that here, we have a whole clinical genetics department that they see all of our patients, and all patients that actually have a diagnosis of ovarian cancer, it is recommended that they have genetic testing as well. There's a lot of research going on to try to figure out is there a tumor marker, is there something like a PSA, is there something screening ovarian cancer, but we just haven't been able to find that yet. And so kind of what I tell patients is, you know your body best. So you have to make sure you're an advocate. If you feel like something's not right, you have to say something's not right, I need this evaluated. You know your body better than anybody else. Knowing that the symptoms are not very specific, making sure that you really have a good understanding of your family history, because that can be important in your risk, and just watching out. And if anything's not right, just making sure that you reach out to your physicians to let them know.
Pros and cons. Pros. He might plan to have her children before age 13. 30. She might choose to freeze her eggs. She might decide she'll have surgery after uh, 35 and after maybe having one or two pregnancies and breastfeeding her babies. She might decide to wait until she's 40. Cons bone thinning, increased rates of heart disease, discomforts of menopause.
Ovarian cancer is a subtle disease. It can sneak up on us like a thief in the night, disguised as common problems such as prolonged bloating, the constant need to pee, and fatigue. While the warnings are the same, the most common type of ovarian cancer begins in epithelial cells, a type of cell that makes up the tissue covering the ovary surface. To best treat ovarian cancer, doctors at Roswell Park first confirm the diagnosis and learn the stage or extent of the cancer. This requires a procedure called surgical staging, during which a surgeon carefully examines your pelvic and abdominal areas. The stage of ovarian cancer is determined by where cancer cells are found in the body. In stage 1, ovarian cancer is found in or on the surface of one or both ovaries or fallopian tubes, or in fluid collected from the abdomen. In stage 2, the cancer has spread from its initial site to other areas of the pelvis, such as the ovaries, fallopian tubes, and the uterus. Finding cancer only in the lining of the abdomen is also considered stage 2. Stage 3 means that the cancer has spread outside the pelvis and is found in other parts of the abdomen, nearby lymph nodes, or on the surface of the liver or spleen. The cancer has reached stage 4 when it's spread beyond the abdomen into other parts of the body, such as the liver, lungs, bones, or in the lymph nodes in the groin. At Roswell Park, we have a highly experienced team of board-certified gynecologic oncologists who focus specifically on gynecological cancers. Know your body. Ovarian cancer whispers. So listen.
Issue applied in Ecuador. The worldwide incidence is higher in women between 50 and 70 years old. 75% of diagnosed cases occur in women uh, more 55 years. In 80% of women, the disease is already advanced at presentation with a low 5-year survival rate. conclusion, across all trial population, regimen of carboplatin, paclitaxel, and Velaparib induction therapy, followed by Velaparib, maintains the therapy led significantly longer progression-free survival than carboplatin plus paclitaxel induction therapy alone. The independent value of adding Velaparib during induction therapy without Velaparib maintenance was less clear.
When we got the results of Forward 1, we reanalyzed all of the assay or all of the specimens using the PS2 by a blinded independent pathologist. So this is a very exploratory analysis, just trying to figure out what happened. And what we found in the distribution of patients who were enrolled, about a third were ineligible for Forward 1 because their folate receptor alpha was actually too low. And then among those patients who were classified as folate receptor alpha high by the 10x scoring, half of those were actually mediums. So our folate receptor alpha high subgroup, which was one of our primary endpoints, was actually diluted out by half by patients with folate receptor alpha medium. So then we reran the statistical analysis just on the folate receptor alpha high, which now is a much smaller population, so we've lost power. So this is purely exploratory. But when we do that and we look at the progression-free survival, it looks like the assumptions that we set forth in the study. It's the control still 3.3 months, because why would that have changed? But the folate receptor alpha high group is now 5.6 months, and the p-value is 0.015. All of the secondary endpoints either are positive or trend towards positive, including overall survival, where our medians go from 11 to 16.5 months. That p-value is not statistically significant, but we lost half of our power. So, we can only sort of make hypotheses based on that, but the trend was clearly there. So I think the conclusion of Forward 1 is it was a negative study. We did not hit on either intention to treat or folate receptor alpha high. We did show a well-tolerated agent with a differentiated toxicity profile, and even at 10x scoring, a signal of efficacy or superiority that makes us believe still that mirvetuximab has a place in the treatment of patients with platinum-resistant ovarian cancer.
Thanks.